In this video, we'll cover the main forms of contraception. The word itself means against conception, but the way each type achieves this is different. Starting off is fertility awareness. Fertility awareness is tracking fertility signs to avoid intercourse during the ovulation window. It has an effectiveness rate between 78% to 99%, with 78% of it being successful. Some of the advantages are that it is inexpensive, has no side effects, and is hormone-free. However, some disadvantages are that it has a high failure rate, dedication is required, and you must abstain from sex during the period. Next is an implant, which is when a healthcare provider inserts a small, flexible plastic rod under the skin of the upper arm. It has an effectiveness rate of 99%. Some of the advantages is that it is long-lasting, easily reversible, and discreet. Additionally, it is cost-effective, does not interrupt sex, and may reduce or stop periods. Some of its disadvantages is that it has possible hormonal side effects, may cause irregular periods, may cause longer or heavier periods, and not all providers are trained in removal. Next is an IUD, which is when a healthcare provider inserts a small T-shaped device into the uterus. It has a success rate of 99%. Some of its advantages is that it is long-lasting, typically 3 to 7 years, easily reversible, and discreet. Additionally, it is cost-effective, contains no hormones, does not interrupt sex, and may reduce menstrual bleeding and cramping. Some disadvantages is that it may cause irregular bleeding or spotting, has possible hormonal side effects, small risk of expulsion of IUD in the first year, small risk of infection, and small risk of tubal pregnancy or uterine perforation. Next is a shot, which is when a healthcare provider gives an injection every month. It has a success rate of 94%. Some of the advantages are that it is discreet and reversible, does not interrupt sex, contains no estrogen, and may reduce or stop periods. However, you must get shots on time for it to be effective. It may cause irregular bleeding or spotting. There are possible hormonal side effects, and there is a delay in reversibility. Next is a diaphragm, which is a dome-shaped silicone cup that is inserted inside the vagina and covers the cervix. It has a success rate of 88%. Some of the advantages are that it is hormone-free, reversible, and reusable. Some of its disadvantages is that it requires consistent use, may cause infections, and may be difficult to insert. Next is the patch, which is an adhesive square applied to the skin once a week for weeks, followed by a patch-free week. It has a success rate of 91%. Some of the advantages are that it is easily reversible, does not interrupt sex, regulates menstrual cycle, and eases menstrual cramps, does not have to be taken daily. Depending on where it is applied, it can be discreet, and may improve acne. Some of its disadvantages is that it must be applied on time for it to be effective, possible hormonal side effects, and possible skin irritation at adhesion site. Next is the pill, which is a pill that must be taken daily. It has a success rate of 91%. Some of the advantages are that it is easily reversible and discreet, does not interrupt sex, regulates or decreases period and eases menstrual cramps, and may improve acne. Some of its disadvantages is that it must be taken daily and around the same time every day. Possible hormonal side effects, may not work as well if taken with other oral medications, and increased risk of blood clots, heart attack, and stroke. Next is the usage of a condom, which is a latex or non-latex cover that fits over. It has a success rate of 85%. Some of the advantages are that it protects against STIs, including HIV, is convenient and available at stores or for free at clinics, is easily reversible and cost-effective, and contains no hormones. Some of its disadvantages are that it must be used each time, requires partner cooperation, may break or slip off, may decrease sensation, and may interrupt sex. Finally is the withdrawal method, which removes the penis from the vagina before ejaculation. It has a success rate of 78%. Some of the advantages are that it is free, contains no hormones, and is easily reversible. Some of its disadvantages are that your partner must be willing and able to pull out at the appropriate time, interrupt sex, requires partner cooperation, and pre-ejaculate may contain sperm.